So, Bernie, why don't you introduce yourself, please? Thank you so much for joining us today. Tell us a little bit more about who you are and what you do.
Well, okay. Thank you, Adam. Thank you for your invite for this presentation. I spent most of my life working for British Petroleum, and 11 years of that I was working in different countries around the world, fixing business problems. Coming back to UK because of my children's stabilization in terms of education, I decided to start VCare Group. That is now 15 years old, and we are a growing company. We are at 31 homes as we speak, and there are more on the pipeline. So we have a lot of success stories. But more of our success was around our people.
Mm-hmm. Yeah, terrific. And let's get straight into this. People, how to, and obviously you've had, continual growth. So it's been finding and retaining these key people has been, as you mentioned, priorities for you. So recruitment, let's start right at the very beginning. How do you go about it?
So the recruitment in many, many different ways. So let me start with carers. So whereas if you want to be also ran category, then you will pay the same rate of pay as everyone else in your competition. We pay higher than any of our competition to attract the right people into our jobs, whether that be in carers, whether that be in nurses. When it comes to our care home managers, we probably have the youngest care home managers in the industry, right? So our average of care home managers is in the early 40s. Our regional managers also, in terms of a category of they all wanting to progress in this company. So it's an excitement for them when we start growing, because that creates opportunities for them.
Obviously, with the salary and the wage, that's a real incentivization. The manager's early 40s. This is a kind of decision that you've made. Is that right, Bernie, that you want to attract younger?
Not by choice.
Yeah.
It's the average age. So we are not age discriminating anyone,
Sure.
but our focus has been on internal development, right? So we want to try and bring people within the company. We do have to sometimes go outside and look for people.
Yeah.
But our preference is to internally promote people.
I see. All right. So you're bringing people in, and you are the culture that you have is one of, okay, well, if you enjoy this and you would like to progress further, there's a very clear path for you to do that.
So, for example, Adam, we had one of our carers who won the prize of lifetime care achievement. She is 87 and she still works for us as a carer.
87.
That's correct.
Oh, that's a terrific story. My PR journalism instincts coming out here. Wow, that's wonderful. Tell me about the recruitment then, and about how you bring in your staff. Right now it's competitive, and even with, I guess, a higher wage, it is still competitive. How do you bring the best talent in? How do you encourage them to come in? How do you feel you do things differently?
We do things slightly differently, but because we are more focused on social media advertising as opposed to the normal channels of advertising. And we also have refer a friend, and there is an incentive that is attached to it. So not a lot of it is different from other people who's doing it. But we have an employer brand that we are building.
Yes.
Right. So my goal in 5 years is to be an employer of choice.
Yes.
So everyone who wants to work in the care home industry must put VCare Group first.
Okay.
Right? Yeah. So we as a part of that, we have been doing a lot of internal marketing, if you like, as opposed to external. Right? So that's our future staffing, if you like.
All right. Okay. So this employer of choice, you really are, as you say, internally marketing that within your own teams to make it answer that correctly, that you want them to continue with you.
So I have a goal, which I will achieve or not, but time will tell.
Yeah.
I want to know the first names of 80% of the staff who works for us.
How many staff do you have?
Just over 2,000.
Yeah.
But that will also grow in time with more opportunities in terms of care.
And this is that's 2,000. It's quite a lot to remember. So
well, it's a challenge. Age doesn't help me, but it's a challenge.
Yes, sure.
But it is more talk to the visible leadership that you are going to demonstrate to your team.
Sure.
So you need to be on the floor. You need to be talking to your staff.
Yes. Yeah. And tell me about that. What do you do? How do you do it? So what do you have? Is it like very systematized in your diary and your schedule? Or how do you go about that?
So my office is based in London.
Mhm.
My businesses are all based in the north.
Yes.
Every other week, I will travel to my businesses. Within 6 weeks, I would have visited every single one of my homes,
Hmm.
and I would have walked the floor
Yeah. Yeah.
in talking to people,
Yeah.
in not just introducing myself, just asking them how they're getting along, how they are settling in. Some people have been there for a longer time. Some people have just starting their ladder,
Yes.
right? And they need to be given the comfort and the feel that this is a very family company.
Yes.
Family doesn't mean me as a family. We are all a big family.
Yes. 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 And what about your employing, finding a good kind of leadership team under you? How have you gone about that? I guess that's been key for you.
I think I don't know about other people. I would say if we all of the 31 homes, barring the new ones that we have bought in the last month, I wouldn't want to say one of my managers is inefficient. I would say everyone is very, very good.
Yeah. Yeah.
Right? I would say everyone is very good. So that's a nice place to be.
Nice place to be. It is, yes. I guess, just the trust that comes with that when your team is delivering for you. And would that be correct, that trust element that you have?
Yeah. So I think what we are building up a culture, Adam,
Mm,
right? That will be unique to VCare Group. Be unique to VCare Group, and without our people, that we have no business.
yeah, of
We have no business. It doesn't matter how intelligent you are,
course.
but you need your people to come behind you.
And Bernie, do you have kind of tell me about some of the incentivizations, some of that culture building elements you might have it built in, to always, because you can't, when you're building a team and when you're building a culture, you can't step off the gas, really, can you, on this? And I'm just curious to know what kind of some of the smaller details you might have, or, you're talking about visiting, so you've got that presence, but kind of what else do you have to build that team and culture?
So starting point is that we do benchmark ourselves with the top sort of 30% of the care home industry.
Mm,
And we want to be leading in every category if we can, or even the most important categories. So we recruiting is one thing, retention is the other.
yeah.
Right? So if you look at care home industry, the leavers within the 6 months is the highest percentage. Why they do leave is because they haven't been looked after.
Mm, mm.
Right? So we have a mentoring system that where people come in, it's a buddying system. So they are assigned a buddy for the 6 months.
I see.
80% of the time, that buddy must work with this person,
Right. I see. Yeah.
right?
Yeah.
And a buddy gets incentivized at the end of that 6 months, or in the first payment of end of 3 months, and the final payment of end of six
Oh,
months.
I see. So the budget's incentivized with some kind of reward.
That's
Thank
correct.
you. Right. I see. Yeah. Yeah. Okay.
So once that is done, it's all about keeping the retention going.
Mm.
So one of which is we have Employee of the Month. One person should be nominated every month from every home, right? Every home. We also have financial incentives that we share with all of our staff, including the managers.
Hmm.
So we create a business plan that is based on benchmark. So the benchmark is the top 30% companies. And historically, in the 15 years, we have exceeded that time and again.
Mm.
That's
Mm.
because of our managers and our staff, right? So they then get to share 10% of that excess money that they have earned, right?
Ah,
So the 5% goes to the care home manager and 5% gets shared amongst the staff.
I see. All right. Okay. Okay.
Okay. We also unique company in we before the pandemic, we used to have an annual staff party.
Yes.
So bring them all, bus them or coach them, bring them into a hotel with their partners. A big thank you to what they have done for that year.
How did you manage all of that during the COVID lockdowns and everything?
Okay, so COVID lockdown, as we are a responsible care home operator, we cannot entertain
Of course.
people
Yeah.
in
Yeah.
inside and crowd. So we decided to give them a Christmas gift.
Yeah. Yeah. I see. Right. What else? I'm curious now. What other kind of things, come to mind in terms of, again, for this team building, recruitment, retention? How else? What else are you implementing?
Yeah, so it's all about little things, but you do them methodologically.
Yeah.
So you have to be rigid in what you do.
Hmm.
Right? You have to make sure that people are following what we are creating, if you like.
Yes.
And for us, the delivery is probably more important than just talking about high level numbers.
Yeah.
Right? So if I said I want a staff turnover of no more than 10%, then I need to have different things put in place to achieve that.
Yeah, I
Right?
see. Yeah.
Yeah. So it's nice to talk about high level numbers, but you had to drill them deep to say what are the things that we need to put right to get
Yes.
there.
Yes.
So
Yeah.
in terms of financially, it's actually an investment and it is not a cost.
Mm.
So for you to recruit a new carer and train them, it costs you a minimum of 1,350 pounds
Yeah.
per
Yeah.
carer,
Yeah.
right? So if you have a minimum number of staff turnover, you're going to save all that money,
Yes.
right?
Yeah.
Now, the industry after the pandemic is running at a vacancy rate of 10%.
Mm. Mm.
We as a company only have 4%.
Mm.
We have lower number of vacancies,
Yeah.
but we still have vacancies. So
Yes.
we got to get to the 0%.
Very interesting. I can see how financially it all builds up and the formula around it. Tell me about when you've had difficulties. What particular difficulties you've had over the years of building the We Care Group on this recruitment and retention. When have things not gone so well, and how have you kind of handled it and reacted to that?
So we tend to buy problematic homes.
Mm.
So problematic homes means either it is CQC wise or regulatory body wise
Yeah.
or financially, right? In both cases, you will see the care home team would be a biggest cause of it as well,
Yeah.
right? With the staff turnover rates and agency coverage, the agency doesn't know your residents, so
Mm.
CQC results become bad because
Mm.
because carers are not doing what the carers are supposed to do. So we have had all those challenges all of our life.
Mm.
So when we take a care home, there's cultural issues.
Yes.
Right? There is cultural issues that are historical, and we need to change them. We know the Rome wasn't built in one day, so it takes time.
Yeah.
But you bring the staff team in first and you talk to them about what we are all about.
Yeah.
We talk to them about how we reward them,
Mm.
right? Both in terms of financially and non-financially,
Mm. Mm.
right? So you tell them up front, if you work for this company, this is what will happen, right?
Yeah.
But at the same time, you also carry some hard messages. If you don't want to work for us and change, then you might as well start looking for another job.
Speaking to other CEOs, often it's the same thing. It's like that change around when you're acquiring an underperforming home. It's the change of culture. That is one of the first things that needs to be addressed.
So 6 months ago, we bought 4 inadequate homes.
Mm.
Right? We have turned 3 of them already into requires improvement. We can't turn them good overnight
Yeah.
because it'll take time. And only one we are waiting for CQC inspection to come.
Yeah.
But we are ready. We are ready.
Oh, that sounds great. And so sounds as though you're certainly doing something right there. So congratulations. And tell me a little bit more about just on the recruitment setup. Well, obviously with a workforce of 2,000, how do you organize your recruitment HR team?
Okay. So we have a monthly meeting, what is known as people's meeting.
Yeah.
Right. So the whole day, senior management and myself, we talk about people.
Yeah.
Whole day, right? Whole day long. We talk about our people. We talk about how to fill the vacancies. We talk about how to personally develop people. We talk about who is our next regional manager, who is our next home manager. So we have a pipeline of people waiting to come in. Then they will be put through different developmental, whether they are being courses, whether they are being exposure. So they would have all of those things, getting them ready. We are not doing anything that is new, but we put a whole day long every month
Yeah.
to talk about our people.
Yeah, I see. Yeah. Yeah, very, very interesting. And I can imagine a lot is achieved during that day, once a month. I mean, I can imagine a lot is covered, a lot is achieved, probably a lot of new ideas are coming out. You've always got your finger on it as well, I guess, if you're doing it once a month for a whole day. Nothing's going to get missed.
That is one way of knowing 80% of your people's first name
Yeah.
as
Yeah,
well.
fabulous, great. That's wonderful, Bernie. What some great insights you provided today. Is there anything that we've not covered during the course of this episode, which you feel that you would like to cover?
No, I think from your question point of view, I think that was the focus that we had.
Yeah,
But I would say it to you, in 2007, when I started my first business of running a care home, I carried the message of if it is not good enough for my mother, it is not good enough for anyone else.
yeah.
Subsequently, lots of people have used that tagline, if you
Ah,
want, and that is fine. My this thing is I wasn't talking about my mother. I was talking about every one of my staff's mother. If it is not good enough for their mother, they shouldn't be working.
yeah. No, that's terrific. It's such a good strapline. Yeah, congratulations for coming up with it first.
I don't know. I'm sure there would have been more people before me as well.
Yeah, quite possibly. Bernie, also, while we're on, obviously you've just done, a significant growth over the years. Tell me about what it takes to achieve that. What have you learned? What have you learned from the things that have gone well and not so well in over the years of now reaching up to these 31 homes from scratch?
95%, 90 to 95%, it has been positive.
Hmm.
There has been one or two negatives, right? And we learn from them. We learn from them in terms of saying, because we were at one point, we were trying to do everything ourselves. So, for example, we had a home that we couldn't turn around quick enough, and it took such a long time only because we didn't find a suitable manager, right? Since then, we said, well, we need a turnaround manager, right? Because then we don't put up with the manager who is not capable of delivering the results.
Yeah,
Right?
yeah.
If anyone can work with us, we will work with them. We will work with them in every step of the way. But if they are so set on their own way of doing things and not prepared to change, then the change is inevitable.
Yeah.
Right? Inevitable, and it needs to take place. And it needs to take place quick. So we now have turnaround managers who goes in and sort out the problem. As I said to you, all of my managers right now, I wouldn't want any one of them to leave, right? So I'm not even talking about, I don't want to get rid of anyone. I'm going the other way around.
Yeah.
I don't want anyone to leave. But my turnaround managers have useful tasks that we will ask them to do. So they don't physically have to go in and support the manager if they don't need to. They can do a lot around internal development of other people, right? And things like that. So those are lessons that we are learning. Those are lessons that we are learning from why it didn't go as fast as we like.
Yeah, I see. Very interesting. My kind of last question for you is right now, April 2022, what's top of your mind in what's kind of keeping you awake at night, if anything? What's your kind of top number one, top priority is something that needs to be resolved?
So every year during the pandemic has been a challenge. Different challenges, different time. The current challenge for us is occupancy, right? Because we are concentrated in the north of England, where the infection rates are very, very high. And so when two people are testing positive, we have limitations in placing people, right? So that occupancy then needs a good cost management to deliver the results.
Yes.
And often I don't even need to tell my care home managers. They already know. So we are a company that we share our profits with every single one of our staff.
Oh, really? You have a profit share, do you?
No. We share how we are performing. We share how we are performing.
I see.
So it's an open book culture.
Yeah.
It's an open book culture. But we do profit share, which is what I said, we share 10% of excess profits with the care home manager and the staff.
Yeah. Yeah.
So, so I wouldn't be there every day to turn off the light at the right time. Yeah. But
Yes.
the care home manager or the staff is there.
Yes. Yeah.
Right?
Yeah.
So if they can turn the lights off in time, they are going to be serving a lot of money for us.
Yeah. Yeah. I see. Yeah, that's great. Great. Bernie, this was wonderful. Thank you. I asked you this before, but again, because we moved on to some other questions. Again, is there anything you'd like to say that you don't feel that you've covered?
I know. So don't get me wrong. I still have a mountain to climb in this industry.
Yeah.
Right. So we learn every day, and I would say I have my own benchmarks. I look
Mm.
at certain homes and then say, why wouldn't I be there? And fortunately, unfortunately, because I look at turnaround businesses, so I don't go into brand new homes.
Yeah. Yeah. I see.
Right.
Yeah.
So my focus now is to look at more of the brand new opportunities.
No, really. Oh, okay. Right.
Right, brand new opportunities, but still will be concentrating my efforts on turning around, turning
Ah,
around home.
I see. Have you set up and established brand new homes up to now?
We have a few land parcels that we
Right.
are
Okay.
moving towards planning and things
I
like that.
see. Right. Okay. Well, best of luck with that. But Bernie, thank you very much. A great episode. Lots for everyone to listen and learn from. So, Bernie, thank you. Thank you very much.
Thank you for having me, Adam.